Rahim. In the previous lecture, we have studied the biosynthesis of ceramide and the sphingomyelins. Now we will study the synthesis of glycosphingolipids. The glycosphingolipids are made up of ceramide and a carbohydrate. The carbohydrate group may be a monosaccharide or an oligosaccharide. The main glycolipids are cerebrosides, sulfatides, and gangliosides. The cerebrosides have a monosaccharide linked to the ceramide, while sulfatides are sulfuric acid esters of the cerebrosides. That is, in sulfatides, a sulfuric acid is attached to the sugar moiety present in the cerebrosides. The gangliosides contain an oligosaccharide and is sialic acid moiety. The most common sialic acid present in gangliosides is N-acetyl-neuraminic acid. The carbohydrate group is attached to the carbon 1 of the sphingosine. Usually the monosaccharide in the cerebrosides is galactose. The cerebrosides having galactose are called galactocerebrosides. The galactocerebrosides are components of the cell membranes of the neurons. A few cerebrosides contain glucose as well. These cerebrosides are called glucocerebrosides. The glucocerebrosides are most commonly found in gangliosides. Now the synthesis of cerebrosides. The galactocerebrosides are synthesized from ceramide and UDP galactose, which is the activated form of galactose. The galactocerebrosides include cerebron, nervon, oxynervon, kerosene, etc. etc. The fatty acid present in these cerebrosides is a very long chain fatty acid which contain 24 carbon atoms or even more than 24 carbon atoms. This is the reaction which shows the synthesis of cerebrosides. In this reaction we can see that a ceramide react with a UDP galactose. Then in this reaction the galactose is attached to the first carbon of ceramide to give rise to the cerebrosides. Now the synthesis of sulfatides. For the synthesis of sulfatides, the galactocerebrosides react with phosphoadenosine phosphosulfate. This phosphoadenosine phosphosulfate is the activated form of sulfate. This activated form of sulfate gives sulfo group to the galactocerebroside, which get attached to the third carbon of the galactose. We can see in this diagram that a sulfo group is attached to the third carbon of galactose. So this is the sulfatide. Now the synthesis of gangliosides. The gangliosides are synthesized from ceramide, hexoses in activated form, hexosamine also in activated form, and a sialic acid, that is N-acetyl-neuraminic acid. For the synthesis of gangliosides, the sugar residues are added one by one to the ceramide by the specific glycosyl transferases. By the addition of various sugar molecules, the various types of gangliosides are produced like GM3, GM2 or GM1. This diagram shows the synthesis of various types of gangliosides. First of all, ceramide react with UDP glucose and ceramide glucose is synthesized. Then this react with UDP galactose and ceramide glucose galactose molecule is formed. Then this molecule react with activated form of sialic acid, that is the CMP N-acetyleuraminic acid, to form the ceramide glucose galactose N-acetyleuraminic acid. This is the ganglioside GM3. This ganglioside GM3 is the simplest form of gangliosides. Then from this simplest ganglioside, more complex gangliosides are produced, as with the addition of N-acetylglucosamine. The ganglioside GM2 is synthesized. Then the ganglioside GM2 again react with UDP galactose and further a sugar molecule is added to this ganglioside GM2 and more complex ganglioside GM3 is produced. So in this way, the ceramide with the addition of glucose molecules and the N-acetyleuraminic acid or the hexosamines, the different types of gangliosides are produced from the ceramide. Now we discuss the degradation of phospholipids. The phospholipids are degraded by the phospholipases, which cleaves the phosphodiester bonds. The phospholipases are found in mammalian tissues, pancreatic juice, snake venom, and in some toxins. Certain pathogenic bacteria also produce phospholipases, which help in the spread of infection by dissolving the cell membranes. Phospholipase A1. It specifically cleaves the fatty acid present at the first carbon of glycerol in a phospholipid, which result in the synthesis of lysophospholipid. Then the lysophospholipid is further degraded by the enzyme lysophospholipases. Then the phospholipase A2. This phospholipase A2, it acts at the second carbon of the glycerol in a phospholipid and it hydrolyzes the fatty acid present at the second position of the glycerol. As we have seen earlier that at the second position of glycerol, often an unsaturated fatty acid, arachidonic acid, is present at this position. So the phospholipase A2 provides the arachidonic acid, which is the substrate for the synthesis of prostaglandins. Phospholipase C, it specifically cleaves the bond between the phosphate present at the third carbon of glycerol in a phospholipid. So as a result of the action of phospholipase C, the phospholipids give rise to diacyl glycerol, and this enzyme is present in lysosomes of the hepatocytes. Phospholipase D, it hydrolyzes and removes the nitrogenous bases from the phospholipids. So, by the action of phospholipase D, the phosphate group remains attached with the diacylglycerol, so in the form of a phosphatidic acid. Then sphingolipidoses are the group of diseases which are produced when the degradation of sphingolipids is impaired. The sphingolipidoses are inborn errors of sphingolipid metabolism. Some catabolic enzymes are deficient, which result in these diseases. The sphingolipids accumulate in the body due to the impaired breakdown of sphingolipids. The sphingolipids are present in large amounts in the nervous tissues. So, in sphingolipidosis, mostly the nervous system is involved. There is some accumulation of sphingolipids in other tissues as well. In this diagram, we can see the degradation of a ganglioside GM1 in a stepwise manner to give rise to the sphingosine. In this degradation, the different enzymes are involved, like galactosidases, hexosaminidases, neuraminidases, ceramide lactosidases, etc. So the deficiency of these enzymes gave rise to the different diseases, which are collectively called as the sphingolipidoses. The major sphingolipidoses are generalized gangliosidosis, Tay-Sachs disease, Gaucher disease, Krabbe's disease, metachromatic leukodystrophy, and Niemann-Pick's disease. In generalized gangliosidosis, there is deficiency of GM1 beta-galactosidase enzyme. Due to deficiency of beta-galactosidase enzyme, the breakdown of GM1 ganglioside is impaired. So the GM1 ganglioside get accumulated in tissues, which causes mental retardation, hepatomegaly, and skeletal deformities. In Tay-Sachs disease, there is deficiency of hexosaminidase, which result in the accumulation of GM2 ganglioside. So due to the accumulation of GM2 ganglioside, it causes mental retardation, blindness, hypotonia, and paralysis. And this disease becomes fatal by the age of 3 to 4 years. Gaucher disease. Deficiency of beta-glycosidase is the cause of Gaucher disease. Due to the deficiency of beta-glucosidase, there is accumulation of glucosylceramide, which causes in mental retardation, hepatosplenomegaly, hypersplenism, and bone erosions. In Krabbe's disease, there is deficiency of beta-galactosidase. So, due to the deficiency of beta-galactosidase, there is accumulation of galactosylceramide, which causes mental retardation, blindness, deafness, hypertonia, and hyperirritability. In leukodystrophy, there is deficiency of aryl sulfatase. Due to the deficiency of aryl sulfatase, there is accumulation of sulfatides. The accumulation of sulfatides causes dementia and progressive paralysis. And this disease becomes fatal by the age of 3 to 10 years. The Niemann-Pick's disease. In this disease, there is deficiency of sphingomyelinase. So as a result of the deficiency of sphingomyelinase, there is accumulation of sphingomyelin, which causes mental retardation, motor disturbances, growth failure, and hepatosplenomegaly, that is enlargement of liver and spleen. And this disease is also fatal by the age of 4 years. The antenatal diagnosis of sphingolipidosis is possible, as the abnormal sphingolipids can be detected in fetal cells which are present in the amniotic fluid. This the sphingolipidosis is inherited disease which is autosomal recessive. This is the chart of the sphingolipidosis. In this chart, the different types of diseases which are collectively called as sphingolipidosis are given, like Gaucher disease, Niemann-Pick's disease, Krabbe's disease, leukodystrophy, Fabry's disease, Tay-Sachs disease, etc., etc., with their enzyme defects, that the deficiency of enzymes which causes these diseases, and then as a result of the enzymes, which type of lipid is accumulated in the tissues is given. Then as a result of accumulation of the lipids, the different types of clinical features are produced, which are given in this column. So this is the whole picture of sphingolipidosis. Thank you.